I need to zoom y'all in. Hi guys, welcome back to my channel. So, y'all wanted to know about VSG. So, let's talk about it. Okay? Get your pen and your paper because we're going to chit chat and I'm going to have notes for you. Okay? Now, at this point, if you know, you know. I had gastric weight loss surgery. I had the gastric sleeve to be exact, not the bypass, but the sleeve, VSG. The sleeve, the doctors go in and they cut how much? Because I got my notes. Where are you? Give me a minute. 75 to 80% of my stomach out. So it is essentially they cut into a shape of a banana. And that is to help you lose weight. Okay? Let's see. At my highest weight when I was pregnant with my son, I was 240 pounds. And I gave birth to him in January of 2025. When I went in for my surgery in February of 2026, a year later, I was 220 pounds. So in that year, I only lost 20 pounds from having a baby. Was I going to the gym consistently? Yes. Was I dieting? Yes, I was. Was I doing all the things? Yes, I was. I was even on a GLP-1. I was on Wegovy. I was on the Wegovy injection where you do, is it once a week or once a month? I don't remember. I was on that. And being on that injection, I only lost between 8 to 10 pounds when I was on that injection. I suffer from PCOS, hypothyroidism, and what else I got? I got something else. What else did I have? Was that it? PCOS, hypothyroidism. Yeah, that's it. So with PCOS, that's polycystic ovarian syndrome. They calling it now PMOS, I think. Yes, polyendocrine metabolic ovarian syndrome. And basically what that is an imbalance of your reproductive hormones causing irregular periods, excessive male hormones, ovaries that may have small follicles, and it just affects a lot. You have a lot of, you can gain a lot of weight, you have a lot of chin hairs, your emotions are all out of whack, you can lose your hair. It's a lot. Okay, and you have to get tested for it. You do have to get tested for it, because it's just like your levels are off. So my levels were off. So thankfully we were able to figure out that's what I had, and it wasn't just, oh, you're just fat, blah blah blah, you're not losing weight, you're going to the gym all the time, you're not losing weight, you just eat whatever you want to. No, 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 no. That's not it. The things were against me. Okay, it was against me. So, like I said, I was on a GLP-1. I was on Wegovy. And unfortunately, when everything was going on in, I want to say 2024, when everybody was on it was skyrocketing. Nobody could keep it in stock or anything like that. Luckily, my location, I was able to keep it in stock. But my insurance company stopped paying for it. They were like, we have to pay $1,000 a month for this, for you to get this injection. And it's not worth it for us. But we'll pay for you to get gastric surgery. I was like, huh? How does that work? So the way they broke it down to me, somebody who worked at an insurance company, they said, we're paying for you to get an injection, $1,000 a whop. You could stop at any time and gain all that weight back. You get this surgery, we are getting a return on our investment because they're eventually cutting your stomach to basically nothing. You have no choice but to live by the lifestyle that you're supposed to live by, and you're going to lose this weight. So you're going to essentially be healthy. Now, granted, some people, they stretch their pouch back out. They do all the things that they're not supposed to do, and in years to come, they have to get another surgery, like bypass. A lot of people can have theirs reversed. You cannot have gastric sleeve reversed. You can't. But you can have your bypass reversed. And I think you can get it bypassed. I don't know. That's not my goal. My goal is to stay on the straight and narrow. Okay? So, in order for me to get approved, I knew I was going to be approved. They already consider me morbidly obese. I'm 5'1", and my highest weight was 240 pounds. And then at that time, I was 220 pounds. So I was already considered morbidly obese. For like, y'all know that it's like a scale that they put people on. If you're a man or a woman, they put your age or your height. This is how much you're supposed to weigh. Technically, mine was like 127 pounds. So they was like, bitch, you are big. We got to get this surgery. So I want to say it took like a week or two for it to go through approval through the insurance company. And it was approved. Ooh, Jesus. Sorry, y'all. And it was approved. So that was that. I found my surgeon an hour away from where I lived. Where did I go through? Dr. Dan. He's amazing. Dr. Dan in Akron, Ohio. What's the hospital called? I'm put it somewhere because I don't remember. Anyway, went through Dr. Dan. Love Dr. Dan. He's amazing. And I had a consultation with him, and we went through the stages of, okay, what surgery best suits you? And it was a few different ways, few different gastric surgeries, but VSG would have been the best one for my age, for me, things that I had going on. VSG was perfect. So it was like, okay, perfect. That's what we do. Now with Dr. Dan, you have to, a week before surgery, he put me on a special diet. The special diet was one or two cans of soup a day? I think it was a can of soup a day. Hold on, y'all. Yeah, one can of soup a day. I can have jello, I can have broth, and I can have 2 cups of vegetables per day. Now, this is initially to shrink my liver because they want your liver to shrink a little bit before you have your surgery. Do they know if you cheating? I don't know. I didn't cheat. I did what I was supposed to do because I was scared, and I did not want to have went through all of these appointments in order to risk that surgery. And you do have to have appointments. My insurance required me to have 6 different appointments. I had to have an appointment, a few with a psychologist, a psychiatrist. I don't know if it's the same person. I don't know. A nutritionist. I had to go through cardio to get cleared. I had to do blood work to get cleared. Had to talk to a therapist to get here because they do not play that. They want to know what's really going on, okay? Because we're not about to waste our time with you. So yeah, I had to do that. I will tell y'all that some insurances make you do a whole year. I know someone personally who had this surgery. Their insurance made them go a whole year of taking classes and stuff like that. Thankfully, Cigna did not make you do that. Okay, you only had to go to 6 appointments, and they were fairly quick. They was like boom, 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 boom. I was knocking all my stuff out, knocking everything out. Okay, so let me see what else I need to tell y'all. Got that? All right, here's some things you need to know before you consider weight loss surgery. You will have to take medications for the rest of your life. Now, the medications I'm talking about are like your vitamins, calcium tablets, supplements, like all of that stuff you're going to have to take daily for the rest of your life. And y'all know I don't think I'm but I need to, and I'm going to do better. I'm going to get back up. Y'all, it's my makeup kit. Okay, sorry. You have to take the vitamins for the rest of your life because initially they're cutting out so much of your stomach. You're not consuming that much food, so you're not getting the nutrients that your body needs. So you have to take those medications. And I don't want to call them medications, but this is a lot of supplements you got to take. A lot. Y'all saw those supplements I have to take. I can't stand. So you have to be prepared for that. You need to have a good support system because when I tell you mentally, it is hard after you have this surgery. Mentally, it will take a toll on you. It will take a toll on you. You have to have a good support system. They have support groups that they want you to go through once you're out of the surgery. So you meet like every 2 weeks or once a month. They want you to be in these Facebook groups and things like that. They want you to have that support if you really don't have it at home because, honey, it's a doozy. It's a doozy. It gets ugly. Okay, so I told you all about the week before. Some surgeons make you go on a 2-week full liquid diet. I couldn't have did that. 2 full weeks with only liquids wouldn't have been me. I wouldn't have been able to do it. The day of my surgery, you do have to stay overnight. So my wife stayed with me. My baby stayed at my sister's house. They got me in, they got me out. Now I can say I did have a little hard time coming out of anesthesia. It was the first time that ever happened to me. I done had ankle surgery on my ankle. I done had a breast reduction. I done went through IVF. I done did all the things. It was really, really hard coming out of anesthesia. My surgery was like in the morning. I didn't really wake up. I can't remember being really up until like 8 o'clock at night. It was rough. When you get up from your surgery, immediately, every 15 minutes, they want you to drink a cc of water. So you know the little medicine cups that's like this big? They want you to do a cc full of those. Is that the full cup? 2 cc's. That's the full little cup of water every 15 minutes. You have to put a timer on your phone. Every 15 minutes, you have to drink a sip of water. They make you get up. They make you walk around constantly because they don't want you to get no blood clots. Okay? So they got you up and moving. did I have drains? Yes, I did have drains that I got them taken out the next day. But they want you up moving and they want you drinking 2 cc's every 15 minutes. Y'all, when I tell y'all I was so sick of that. And if you go to my Amazon storefront, it's in the description. I have a thing that says VSG things. So like things that you need for your surgery, that's in there. But baby, that was ridiculous. So they sent me home. The next day, I was cleared to go home. They sent me home with my meds. They gave me, a nutritionist came in. They said, this is what you're going to do. You're going to be on a clear liquid diet for a whole week before you come back for your post-op appointment. So you're not eating anything because your pouch is so sensitive. It's like a new stomach. You're like a newborn baby. So they put you on a clear liquid diet. So I can only have broth. I only can have popsicles. Now, mind you, it's still just the 2 cc's. So it's not like I'm in here having a bowl of broth. No, you cannot, because that stomach is very tiny. It's very petite, like your friend here. That's all I can have. Now, once I went to my first week post-op visit, they see if you lost weight. I did lose weight. I don't remember how much. I did have to be not admitted. I did have to get sent down to the emergency room, and I had to get a CAT scan because I was having severe migraines to the point where I felt like I was about to pass out. And the reason that was happening is because I was dehydrated. Because trying to get them 2 cc's in every 15 minutes, it's hard. It's really hard, but you have to try your hardest. But I was dehydrated, so I needed fluids. They were scared about a blood clot, so they immediately got me in for a CAT scan. Everything checked out clear. So I was able to, get some medicine in me and all that jazz. Sent me home. He kept me on that clear liquid diet. He said, I want to keep you on this clear liquid diet. I'll see you back in another week. When I got back in another week, I was able to progress to soft foods. When I tell you I was happy, I was happy. I should have been scared, but I was happy. So the soft foods that you can have is 2 ounces of salmon. What else was soft foods I can have? Cottage cheese, ricotta cheese, Jello, yogurt, things like that. It was nothing that was, I wasn't about to have no steak dinner. I did slip up. I did have a little bit more than what I should have had, and immediately, as soon as that last bite went down, it's called dumping syndrome. That's when you're eating too much. You don't have no choice but to get it back out of you. It's coming up whether you like it or not. And when I say that, it hurts so bad. And I only experienced that one time because I learned my lesson. I said, you can't eat how you used to eat. How I could clear a plate and go back for seconds. I can't do that. I don't even eat out of a regular plate nowadays. You know the Tupperware, like the little glass Tupperware. We have small glass Tupperware. I put my dinner, lunch, breakfast in a small glass Tupperware, and the small ones, and I still don't finish it. You have to know your cues on when you're full. When I know I'm getting full, I start to get gassy right here. I start to have a belch. I burp. Belch. I heard that a long time. I start getting gassy and I burp. And I know it's too much. Don't push yourself. You can no longer drink out of a straw. They say you can't drink out of a straw never because of the air that pulls from the straw. They don't want it to get in your stomach and fill you up quick. 4 months out, I started sipping back from a straw. Is he going to be happy at my 6 month? No. Is he going to tell me to stop? Probably. Yeah. Another thing, you have to set a timer. You cannot drink anything 30 minutes before you eat or 30 minutes after you eat. It has to be 30 minutes in between before you can drink anything. You're going to be drinking water. You're not going to be drinking no more juice no more. You're not going to be drinking pop no more. You're not going to be drinking no coffee, no tea. You ain't drinking none of that. No liquor. You're not drinking none of that. And if you drink alcohol, just know you have to stop, because you can become an alcoholic because it absorbs so quickly because your stomach is so tiny. You're going to be lit like that. And it's a slippery slope to being a drunk. So watch yourself. Okay? Watch yourself. This surgery saved my life. This surgery saved my life. I had issues with binge eating at one point in time in my life. And it saved my life. Not being able to get the weight off, and my son saved my life. Because I wanted to be here for my son and my wife. And I just kept thinking like, damn, what if something happened to me? Or damn, I can't go outside and chase after him and run and play. I knew I had to do something. So me and my wife talked about it, and this was the best decision for me. But back to the eating. Your whole mindset has to change. There's so much food that I cannot eat that back in the day I could throw down. Ribeye steak, I could have toe it up, toe it down. Now I can get, if I cut like 3 strips on my plate, 3 strips, not no big strips, small strips, I can maybe finish the 3 strips. That's it. Not even a lot. Carbs, you can forget about it. Don't agree with me. Don't agree with me at all. Vegetables, don't agree with me. So I have to do my greens drink. It's too gassy. I can't do it on my stomach. It hurts. It's uncomfortable. When we go out to eat, I order off the kids menu. So be prepared for that. The first time we went out to eat, I ordered from adult menu at Cheesecake Factory. Wasted Shay's money. You'll be eating off the kids menu. Me and Noah share food all the time. All the time. I love that for me. This past Friday, we went and got tacos from our favorite taco place. I ordered 1 taco. I struggled to finish the last bite, but I finished the last bite. I tried to sip pop once. Got sick. Can't do it. Carbonated beverages, it just doesn't sit right. Now, are there some people out here who does all the things that they're not supposed to do? Yes, it is. Why did you get the surgery? If you're going to be eating fast food, if you're going to be going out, if you're going to be doing all of that stuff, why are you doing it? Luckily for me and my wife were already on trying to get our shit together. So I had already cut a year. It had been like over a year. I already cut that stuff up. We don't eat fried foods, and we do every now and then get some fried chicken. I'm not going to lie. We do. And I have like 2 or 3 flats. That's it. But as far as cooking with grease like that in the house and fried food and all of that, French fries, I can't tolerate potatoes. I can do a little bit of sweet potato, but that's about it. I can't tolerate potatoes. Pasta, can't tolerate pasta. I can do a little bit of the Barilla protein pasta. They sell that at Walmart and Target. Not Aldi's, but I know Walmart definitely because that's where I get it from. I can tolerate a little bit of that. Certain dairy, can't tolerate it. Can't tolerate it. Cheese, you can forget about it. I can't tolerate it. But it's okay because I have found workaways around that. I do almond milk. I do a lot of low fat or dairy free cheese, and I don't really eat it that often. You know what I mean? You have to make sure that you're getting your protein in daily. So I do my protein shakes because I know I have to hit 60 grams of protein a day. If I have a shake, at least 25 to 30 grams. Then I'll have some eggs. Then I know I'll have some protein at dinner. They want you to have protein at every meal. Every meal. And you have to have small snacks too. And you have to be careful too, because I noticed with me, my weakness is sour cream, cheddar sour cream potatoes. I can eat. I have to be careful because I'm getting full of that. I don't want to eat no food, and I'm not eating no protein, and that's all I'm eating. I'm getting full. I'm still losing weight, so I'm like, hell, no, sister. What are you doing? What are you doing? No, let's not do that. So if you need to keep a food diary, which I do, keep a food diary. If you need to write down what you have for breakfast, lunch, and dinner, If you need to make it fun by color coordinate things and doing all that, you do what you have to do. You have to get a food scale as well, because you have to weigh your food out, because you cannot go over the 2 ounces. You just can't do it. Why would you go through all of this stuff just to fail? Like, no, that's not the point of the gastric sleeve. What else I need to tell y'all? Going to the gym and working out. You have to eventually, once you get cleared, you need to get back in that gym or start that gym. I don't care if it's just you walking on the incline for 30 minutes to an hour. Okay, start off at 15 minutes, because when I went back to the gym, I couldn't do anything longer than 30 minutes in there. I was so fatigued because I was so tired, because I was burning so many calories, but I wasn't taking in, the same amount of calories, because you can hardly eat. So getting back to the gym, that's my space. That's my mental space. I get up at 5:10 in the morning and I go to the gym with my sister, and I get to chit chat. I don't have to be a mom. I don't have to be a wife. I can just be a homegirl and just chit chat, laugh, and just enjoy my time. That's my mental. You know what I mean? And seeing the weight coming off and seeing it tone it up and things like that, like, okay, she flexing. You can see like where your areas that you really want to work on. My wife asked me once I was finished and got to a weight that I was comfortable with, and I don't know when that's going to be. I don't have a weight that I'm like, oh, okay, this is what I want to weigh. I'm 176 pounds now. I've never been 176 pounds in my life that I can ever remember. You know what I mean? So I can't sit up here and say, oh, when I reach 143 pounds, that's going to be it. I don't have no goal like that. I just want to look good and feel good. Okay. I don't know what weight that's going to be. But going to the gym and working on that. But my wife asked me, when you get there, do you think you want to have any more surgeries, because you're going to have loose skin? And at first I was like, no, like I don't think that I want to have another surgery, because the gastric sleeve was so rough on me, guys. Like, recovery is hard. If you think you're going to be back to work the next week, and they tell you, oh yeah, you can go to work the next week, it's not happening. So say that PTO up, sister, or get that short-term FMLA, because you're going to need it. You're going to need to take your time. You're going to need to take your time. Even if you work from home, you're going to need to take your time getting back. So save up that PTO bank, or take that short-term disability, that FMLA, because you're going to need it. Secure that job. You're going to need to take the time off. I don't want another surgery. I had a C-section, and then I went through gastric sleeve all within, it was basically a year. I had my son January 2025, February 3rd of 2026, I had the surgery. So it was like 6 days short of a year that I had 2 major surgeries. Never mind the fact that a week after I gave birth, my son, I had to be rushed back to the hospital because I was losing so much blood. I had to have an emergency DNC. I lost over 2.5, was it pints or quarts? It was a lot. Like, when I tell y'all, it was just gushing out. It felt like I was using the restroom, like urinating. That's how it felt when it was just pouring out of me, and I didn't know what was wrong. They rushed me to the emergency room, like something is wrong. They said, get here now, labor and delivery now. That was an ordeal. They didn't play. My doctor did not play. The one that did my C-section, she got me in and she said, no, come on now. We don't have time to talk. You talk to your wife, let her know what's going on. We got to get you back there. That was a lot on me. So I don't want to have another surgery. So I'm doing the things that I need to do now by eating the protein, lifting the weights. Like, of course I'm going to have loose skin. I'm starting to have loose skin now. I can tell, like, look at this. This is starting to get really loose. I'm going to only be able to tighten it up so much before it's like, okay, you have loose skin. So depending on how it looks and how I feel, like, I feel so sexy right now at 176 pounds. I feel so sexy in things that I wear. I'm not saying that I want to be having no thong 2-piece on or nothing like that. I mean, I had on 2 pieces before when I was 220 pounds. Okay, don't get it twisted. Big Mama was still looking good doing her thing. But I don't know if I want to have skin removal surgery. I don't know. Maybe, maybe not. I don't know. It's so much going on. I'm scared. I got this boy I gotta take care of. I got this wife I gotta take. What they gonna do? Something happened to me. What they gonna do? I, I'm just gonna tuck their skin in. But my wife supports me fully. She said if you want to have I think it's called a panectomy when they remove the extra skin, and you know your insurance will cover that. They sure will. They will. But I don't know. I guess we'll have that discussion when we get there. Who is that? We'll have that discussion when we get there. But yes, it is a mental. Every day it's a mental. Not being able to eat the things that I used to be able to eat, not being able to go out and have a drink. I'm 5 months out and I have had 2 drinks. And I haven't even finished them. I drink maybe like frozen margarita, maybe like this much. We getting ready to go on a cruise for I can't tell you what. We getting ready to go on a cruise. And my wife was like, let's get the drink package. So, of course, if one person in the room gets a drink package, they make both people get the drink package. So, I'm like, I mean, I don't drink like that. So, we just basically just wasted money because I can't drink like that because I know it could be a really slippery slope when you drinking. And I want to be mindful of that. You know what? I don't want to fill up on wasteless carbs. You know, I don't want to do that. I want to do the things that I'm supposed to do. This was the best decision of my life. If I had to do it all over again, would I do it all over again? It's rough. It's rough. You have to go through it. That's all I can say. You can never be prepared, baby. You can be prepared with everything you buy. That's what you can be prepared for. You can be prepared for knowing what time your surgery gonna be. That's what you can be prepared for. But like, okay, I got this. I'm gonna lock in. You're not gonna be prepared. You're just gonna have to take it one day at a time. Take it one day at a time. It's a mental battle, but you have to remember the end goal. You have to remember what you're doing this for, who you're doing this for, why you're doing this. It could be a beautiful thing. My knees don't hurt anymore. My hips don't hurt anymore. I'm comfortable in clothes now. This shirt is a medium. Your girl was in January. I was in a 2X. This shirt, I can't stand up because my bottoms. Y'all got to top up. But yeah, it's amazing. Like all my clothes are, when you see your clothes drooping on you and your wife is like, I need you to go and order some new clothes because I don't know what's going on. I'm fitting clothes as I can go into the store and buy clothes, or before is I just order everything online. So now I have to find out what my style is because I never had a style. I just wear baggy t-shirts and leggings and tennis shoes. And now I can fit these clothes in large and mediums. And I have to get out of the habit of thinking that I'm still as big as I was and stop trying to buy too big clothes because you're not that big anymore and things can fit you now. And you're fine. You're fine, sister. You're fine. But it was the best decision. If you guys have any more questions about it, please let me know down in the comments if you're thinking about it. Like, if I have any answers to it, I will let you know. If I don't have this, I'm like, baby, I ain't got it. But do your research. Do your research on your doctor, okay? On the rate. They should be able to tell you their rate on the success rate from their patients and things like that. Don't let TikTok and these Facebook groups scare you. Don't do that because a lot of people have horror stories. And it seemed like the week before I had surgery, I was seeing everybody's horror story was just kept popping up on TikTok. I said, what is this? What's going on? Don't let it scare you. You got this. If this is something that you really, really want to do. But yeah, I love it. I love my life. I love everything. So I love you guys so much. Thank you for hanging around. And yeah, let me know in the comments. Make sure you save this video. Share it to somebody who you think need to see it. Do whichever you need to do. Come back later. Ciao.